services, how you are positioning the wash facilities, how you construct the wash facilities, how you put the materials and the workmanship. But importantly, we are dealing with the institutions. AMREF has been working very much with the institution to build their capacities to ensure that there can be timely responding to the climate crisis. For example, in Hanang, how have we worked with the institution to make sure that they are responding timely and they are addressing the issues that happen at community level? But importantly, we are also working with the communities. So 3 things that you should remember on addressing climate resilience: institution, infrastructures, and the community. The community, how do we dealing with the community? How do we empower the community to make sure that they clearly understand at the local level issues about the climate vulnerability, climate adaptation, climate mitigation? We have a lot of players and other sectors that are dealing with these climate changes. How are we coordinating and get the synthesized message to get it to the community so that this community can be able to respond, to communicate, and to adapt to the changes? So AMREF, we have been working with other players, the CDC Tanzania, in Hanang, to start by analyzing the situation. How these situations have affected the community? We have worked with the institution to make sure that we build the institution capacity in responding to the climate hazard and the climate vulnerabilities. And also we have worked to ensure that the capacity as a cross-cutting issue is well transformed to within the institution, but within the community. So in Hanang, to make it a summary, that we have worked and we have collaborated across the other partners to ensure that the climate resilience frameworks are well addressed. We have worked on the vulnerability assessment. We have done the vulnerability assessment there just after the mudslide event. We have worked on the exposure of the community, especially the people who have been much affected by the slide. And we have taken all measures of technology to ensure that we are putting in place smart climate technologies for the people to gain their survival and gain their livelihood. So that's what you have done in Hanang. Thank you.
Thank you so much, Engineer Mturi. And I believe you can also share like what other stakeholders in government can work together in terms of specifically preparedness and response for such aftermath of climate change. Very briefly, 2 minutes. What's...
Yeah, as already mentioned by the moderator, but also other players, speakers, is that the issue of climate is not a one-man show or a one single sector to address or to respond. As I said, we have multiple players, multiple sector, and cross collaborations. As we are speaking here, we are many sectors, many players that we discuss a single climate crisis, but we have multiple approach and multiple collaboration. So from the global understanding is that there are a number of collaborative initiatives from the COP up to 29 now. We have the international treaties, how can you work together on the climate issues, but we have the local and the national guideline and the principles. So at the local level, as I said, we have been working with different players, as I mentioned, for example, CDC, the government are the leading stakeholders, the community, and the cross-cutting issues, sectors. For example, we have been working with the TMA to get the information and the climate services information to trickle down to the community. We have been working with the Minister of Health very comprehensively. We have been working with the Minister of Water to ensure that water are available and accessible by the community. We have been working with Minister of Education to ensure that this education are trickled down to the pupils and to the community to ensure they have proper education. But importantly, we have also been working with the community health workers to ensure that these are the frontline workers that are pioneering and take the climate change issues and understanding at the community level. So it's a multiple discussion, a multiple collaboration, act at the local, but effect at the global scale.
Thank you so much. So thank you so much, speaker, our distinguished speaker. You've really given us a lot of information for people to digest, and I'm sure the participants will really want to maybe know more insight from you. So I would now want to open the floor for questions and answers, and we'll start taking round of questions in case you want to get further clarification or comment or question to our speakers. The floor is open, and I believe there'll be some microphones. So there's one there. Is somebody distributing the mic? Yeah, one behind there. Yule mkono wa pale, the row, and then we'll take like maybe a round of 3 or 4 questions, maybe 4 questions, and then we'll.
Good afternoon. My name is Prosper Chaki from Ifaka Earth Institute, and I work on vector-borne diseases. Thank you very much for the panel, and I've actually been doing some word count. The first word is resilient communities, and the second one is adaptation and coordination. The one key question that I have, and maybe this is for the panelists, is what I've not seen is anyone talking about the triangulation or integration. You've all talked about very good, excellent initiatives. But what I've not seen is the integration. What is the approach for integration? You've talked about, it's very good that my colleague from, I'm not sure, is it the Safe Water Project? You've talked about the operational decision support system, which is very excellent, influencing planning and designing. How is that influencing all other programs across the country? How is the effort from UNICEF, the Ministry of Health, the National Malaria Control Program, AMREF, how are these coordinated? We used to have the One Health approach, the desk within the ministry, I think Prime Minister's office. What is the role of the One Health desk in terms of coordinating these all efforts and incorporating predictive models to foresee future emergencies?
Thank you. My name is Ayub Dafa, a medical student from Kairouki University. Thank you, panelists, for eye-opening discussion about the effect of the climate change. But my comment or my concern, and I like to thank Mr. Mturi addressed that there is a multifactorial thing that should be addressed in several areas. But I would like to know their role that has been played to the local governments that to reach at that very local level of the citizens. because in our society, the climate change is still mostly seen as a natural calamity, especially for things such as heavy rainfall or floods. This landslide is seen as just a natural calamity coming from God, but it's not. The citizens still, they don't know that they have a part to take to reduce or to omit these changes, which bring a lot of effects, such as washing off plantations, which bring about a lot of effects to the community and nation at large in terms of economy. So I'd like to know the roles that, or what efforts is done at the local government to reach out to the citizens to get this education that they have a role to play in changing this.
Thank you so much for a good question. Can you pass to the lady here? And then there's someone there, and then we'll.
Thank you, Madam. Right. Thank you so much, panelists. I'm Felista Mayala Bwana from UNFPA, and I've got 3 small questions. I think there was much of a focus of the. There was much focus actually on the vector-borne diseases, you know, like the issue of cholera, malaria, and the others. But me, I have a bit of different issue, which I would also like us, as part of the health, specialist and the technocrat, we look at it. The issue, the impact of climate change in sexual reproductive health. Most of the time, I think this is an issue which is like, there's no harm when it comes to sexual reproductive health and the climate change. But we have seen in the Hanang mudslide in Manyara, we have seen in the floods in Rufiji. I have example of people, women who are really a pregnant woman with labor just covered by mud. How does that come out? And it was a struggle for healthcare workers in Manyara to be able to deliver such kind of, in that kind of situation. So I think this is an area, I'm not quite sure if we have, the government is here, they also help in responding, if we have also a clear adaptation plan for such kind of issues, that because you know people will not stop delivering. It doesn't matter that there's crisis, there's flood, there's what, they will not stop. People will want to deliver, will want to do this and that. So this is one issue. But the other thing I'm looking also into, I feel like the climate change issue is also an individual kind of issue. The issue of adaptation starts, I think, also from us as individuals. And this is, I'm looking at it, looking into the, how do we maximize the use of technology to ensure that, for example, we do our meetings successful, we do our many other things. Most of the time, we prefer also travel, but my colleague from UNICEF talks about the carbon emissions. There's a lot when you look into the calculation and how much we are spoiling the environment for travel, for big, small things, printing documents, just not switching off your the light, very simple things. But this is more of behavior, which we may need probably to adapt as well. And my last thing, looking to the issue like cholera, I remember when, during COVID, because everybody was afraid of COVID because people died. And then there was water everywhere and soap. I remember in Dar, Kisutu, wherever you find there's a big tank of water, everybody was washing their hands. And I remember the minister gave the data that cholera in Dar was not there during COVID. I think you, Madam Moderator, will be my witness as well. Then that is a very good positive behavior. Why shouldn't we maintain? How do we do as experts to promote such kind of behaviors so that we don't need to be suffering every now and then for things that does not need even medicine? You just don't need even to go and see the doctor. It's just to change your behavior. So some of these things I feel that it's important that I bring them here. We can be able to discuss. Thank you very much.
Thank you very much. And one last question, then they will respond, then we'll go another round. Yes. Yeah, that's good.
Thank you so much. First, I would like to comment on the presentation skills and information that is being delivered by the panelists. but I have one concern, and any of the panelists can address this. My name is Jerome Justin, a medical student from St. Francis. Now, with regard to One Health approach, I am curious to know, as a country, are there initiatives to consolidate health practice that we daily do, all clinicians daily deliver the services to the clients with the issues or climatic agendas, or not? And if there are, how well implemented are they? Or can we come up with a good framework to integrate these two components? Because we see there is a great influence between climatic changes with health. Yesterday, I just got amazed how there is a movement to link between these chronic diseases like HIV with NCDs. Whenever a patient comes with these non-communicable diseases, they screen for the HIV, or HIV they screen for NCD. How do we interlink health climatic agendas with health practices? Thank you.
Thank you so much. And before our panelists respond, I would like to invite Dr. Ntuli to share a bit of a response on some of the things that I've highlighted. Can you pass the mic to Dr. Ntuli? Thank you so much.
Thank you very much, and I must commend the panelists for the very good interventions. I think there were some of the things maybe missed from the panelists, but this is not something to blame. On the policy perspective, right now we have the National Health Adaptation, Climate Adaptation Plan. The first one began in 2018 to 2023. And right now, we have just finished the second one, and I must commend the Regional Director for WHO Afro-Elect, Dr. Faustin, because he created an impetus for that to happen. He gave us an input, and that will begin from 2024 to 2030. So among other things, there are about 10 components, and in each component we have strategic objectives. And a couple of questions which have been asked from the floor, actually they are a part of those components. And one of the very, very important thing which has been addressed in the National Climate Health Adaptation Plan is the issue of integration. And in that document, it has clearly spelled out that a primary health care, that will be the point of integration. And I think that's the essence why we are having this a theme that we need to capitalize on the presence of very strong and robust primary health care in the country. And with regard to issues, and a bit touched by my sister Felista on the issue of reproductive and child health, the issue to do with mental health, they are all part of the new national climate change adaptation plan. So it has also touched on the how to deal and how to go about with the issue related to the maternal, newborn, and child health, the issue of effects of temperatures on the maternal health, the rise in the sea levels, and other things that were mentioned by the keynote speaker. So we have a policy document in place, and we will soon start to disseminate to different stakeholders. This is a quite very pertinent issue, which we cannot afford not to share to different people, because in so doing, we will be left behind. Every nation around the globe is rallying behind to making sure that they create health systems that is resilient and is adaptable to the climate change. We have had a number of resolutions from May this year when we were attending the World Health Assembly, going to Congo Brazzaville, where we were able to get also our new regional director-elect. But to UNGA last week, we also had that one. So what we're doing now is to make sure this document aligns with all these international and regional resolutions and also commitments that have been given by the head of states. So I thought I should compliment to our colleagues here, because that is a very important document to have and also to be spoken about, because it will enrich the discussion we are having right now. Asante.
Perhaps, thank you so much, Dr. Ntuli. You have really helped in clarifying a lot of questions which people came up. And I think we have seen the Health National Adaptation Plan that was ending in 2023. And I'm glad to know that we have a new one which is developed and it will be shared. I encourage people, stakeholders here, to get hold of that. But that is very key now as we're implementing health and as we're strengthening primary health care. It's very important we also make sure that we are integrating climate change resilience interventions in our programming. I will let now maybe you'll start to respond if there are any questions which are raised, and then just a few minutes because we are running out of time. Yes.
Asante sana. And thank you, Dr. Ntuli, for flagging the great work being done in Tanzania. I also wanted to commend the government because in the topic of integration, the current restructuring of the community health worker program here in Tanzania is working on that integration to prevent the silos of all the different NGOs and UN agencies working in all these different sectors with a different variety of community health workers, but now the government has decided to bring them all together to create a very robust, integrated approach. And within that, when we talk about adaptation to protect child nutrition, that's one of the key aspects of the new curriculum. And just to comment on my esteemed colleague from UNFPA, I think it's Farista. Absolutely, the climate crisis is a gender crisis. It disproportionately affects women and girls. Like I mentioned with post-disaster, beyond just sexual reproductive care, you also have the caring duties of women are significantly hampered, and the burden is crazy. It all falls on the women to do the caring and to do the recovering. And I really liked, I do agree with you, the important role, it does begin with us. And I also want to say for us not to take our eye off the ball, that the structural change that needs to happen in the systems level and the regulatory level, working closely with government to regulate the systems and the companies that are driving a lot of these issues. And I always say this, I don't know if most people in this room know this, but does anyone know where the term carbon footprint came from? Anyone? The term carbon footprint. Anyone know where it came from? It came from the oil industry. The oil industry made that up 30 years ago because they wanted to take our eye off the ball and make us focus about individual behavior while they were messing up the systems in place. And the same thing is happening now with food systems and individual behavior versus allowing food companies to just run wild with our food system and destroy our health and our planet. So we have to do both. It starts with us. It also starts with us working with government to regulate the right companies to do the right thing for health and planet. Thank you.
Thank you very much. If there's any question addressed to you?
Yeah, it's not a question as such,
brief?
but I would like to add on what Dr. Ntuli has just said. In the Ministry of Health, realizing that vector-borne diseases is a cross-cutting, we needed to have different sector in board. We have established what we call multi-sectoral collaboration platform, where we have a focal point from each ministry. So that is the right platform where people from different sectors sit and discuss issues related to vector-borne diseases and come with a joint action plan. Thank you.
Great. And Turi, do any question you want? Okay.
Yeah, thank you. I will respond on the question from a guy from Cairo University. on multiple factorial, the role of local government to reach the community. So as I mentioned, and I said that climate resilience need a strong institution capacity. And it's very clear that the role of the local government authorities are very clear on the ground. Taking the case of Hannah, it was that we worked very close with the local government. We analyzed all the situation, and we put all the strategy towards the community. And the local government was very able to reach the community with support from AMREF and other partners. So to stress on that, to emphasize on that, is that we need to work and to collaborate with the local government in our spaces. But also we have the SOPs that are guiding our collaboration and our strategies that the local government can take to the community. So it's something that we need to work on that, knowing that it's only the local government that can be leaders as the other players to the community, and they have been doing very good. Thank you for reminding, and I think it's a key point to take forward.
Thank you so much, Engineer. Karibu.
Asante. Just to compliment also to my colleagues and Dr. Ntuli. One additional area of sharing Mr. Chaki from Ifakara Health Institute, we have the National Technical Working Group under the Ministry of Water, which brings all the DPGs and the other partners really to share and inform on various development initiatives, including the climate change issues. On technology application, Madam Felista, very local technology which is being adapted by the children in schools, Kibuyu Chirizi, to emphasize on the hygiene promotion in terms of nawa mikono, epuka kuharisha. Can we all say, nami? Say, nami. Unajibu, eku. Yes, nami means nawa mikono. Eku, epuka kuharisha. Epuka kuharisha, nawa mikono. So this is a technology really that has been promoted in schools and replicated back into their respective families. Asante sana.
Thank you so much. Round of applause to our speakers. Now, for the interest of time, we know people have a lot of questions. We are supposed to close so that other group can come in. And I'd like to take this opportunity to welcome our guests, WHO Regional Director, African Director-elect, to present some awards to AMREF. And thanks. And then later we'll take some. Oh, we start with the photos. Yeah? Pardon? After this. Ah, okay. Karibu sana mheshimiwa. Karibu sana. Hapa tunampa mkabidhi ngoja nije na. Mkabidhi mkurugenzi wa AMREF sio? Anaja kusema kitu? So can you come and guide us? What are we saying? Okay. Labda tunasema kumkabidhi. Okay.
Thank you everyone for the participation of the forum that was continuing. This is This is an award from us THS as a recognition of your contribution in dedication in improving healthy care in Tanzania. I'm supposed to give it to AMREF. Representative from AMREF, please. Yes. And this is a certificate of participation for your support and participation in the Tanzania Healthy Summit 2024. We appreciate your enduring partnership. Thank you.
Nataka tupige nayo picha hapa watu wa Amref juu kwenda juu. So, thank you everyone for attending this session, for your contribution, and I'm sure this is the beginning of very important conversation of making our community resilient for climate change. Some of the low-hanging fruits that have been discussed here, including how can we make community resilient to issues of vector-borne disease, issues of food security and storage and nutrition, especially for children, but also how they can use weather information system to avoid aftermath of floods and other community climate impact situations. So thank you so much, and have a nice afternoon and good evening. Thank you.